So we're part of the Catalyst for Care project. It's a regional project. It's actually got 2 strains supporting social enterprises, but our strand is supporting micro enterprises to set up and develop. So I guess in order of how the project has developed, so the project started in Pembrokeshire around 2019. So I'm Lee James. I lead the micro enterprise programme in Pembrokeshire. It then became live in Carmarthenshire.
Yeah, so hi, I'm Lucy Cummins and I lead Carmarthenshire. So I started in March in 2023 and just growing the directory.
Yeah, and I'm the latest recruit. I'm Sue Lewis. I lead the project in Ceredigion. I started in January 24 and onwards and upwards.
Micro enterprise is a small independent care or support service. Micro means that it employs less than 8 full-time equivalents, but the large majority of micro enterprises are self-employed, and they provide services that help people to live independently and well in their own homes and community. So thinking about home help, helping people with like cleaning and shopping and meals, companionship, helping people to do what they love and enjoy life, and then personal care as well. So that's kind of the 3 kind of broad areas that they work in.
Well, the clients become your friends and the family become your friends and we become like family.
Yeah.
And it's, I can't say that I would go into a client's house and if I'm there for an hour, I could be there for an hour and a half. There's no time schedule. My phone is always on. If they need me, if I can, me or any of the girls would go above and beyond for them, and I think that's the difference. They know that they could pick up the phone, and if we can, we would be there.
They've got somebody.
Yeah, they've got
phone.
somebody. I mean,
Yeah.
I've sat and spoken to on the phone to somebody for an hour and a half, just because it's not because I'm getting paid for it. It's because I want to, and I think that's the difference. It's not a job where you go in and out, and there are restrictions of what we can do because we are. We're in the Catalyst for Care, so there is, but we do become like family.
There are huge benefits to being your own boss. I think the thing that I enjoy about it most is it's quite a unique relationship that develops. It's a real friendship. It's not just the person that I'm working with, but it becomes about their whole family, my family. It's very it's just life, I suppose.
It's a part of the day I can look forward to.
Well, you do rehabilitation. So you go to the gym twice a week-ish.
Yeah. And I was having physio sessions. Angelette was taking me to those. The weekly gym sessions. We're like a shopping or coffee trip, like to meet up.
Taking you to meet your friends, you have a couple of friends. Or
Jeanette's able to drop me places. My friends come to the house and we both enjoy a catch up.
Around 85 in Pembrokeshire. So Pembrokeshire was the project that started first, and then Lucy was next.
Yeah, so we've got 48 micro enterprises on the directory.
Yeah, I've got half of that, 24, but only been going for 6 months. So, and there's less population in Ceredigion, so that's my excuse.
And what we want to do is just provide more choice and control over the care people have.
But when I first started, there wasn't as many as there are now. It's really grown, isn't it? And also Lee had posted, Tim had obviously spoken to him and he had posted, so I responded to the post that Lee put on, our chat, and that's how I came to be here.
We don't live far apart.
No, and it's, I just, I'm only Tavispite, it's only up the road.
So the directory is a list of all these micro enterprises who have committed to our Doing It Right standards that we've helped to support to set up, which is a free service. We've supported them on a one-to-one basis. They've committed to our good standards, having an enhanced DBS, and the right insurance, the right training, and then we put their details on an online directory. So a member of the public or a professional can just go online and see more information about what the service is and a list of all the people there. And they can also make an inquiry now, so they can put in, I'm looking for care in Templeton, and then a list of all the people will come up for them to have that choice of who they want to support them.
You go onto the Planed website www.planet.org.uk, and then on that website you click on the blue heart, which is up in the right hand corner. That takes you directly to the Catalyst for Care site, and you can choose which county you need the information for.
So we're RIF funded through the Welsh Government Regional Integration Fund.
So we're secure for the financial year after next. That's Lucy and I. A little bit different in Ceredigion.
Yeah, I'm funded by UK Share Prosperity Funding. That runs out at the end of December. But hopefully there will be funding because it's already making a difference in the county. We're all getting older. I think the prediction, I think already in Ceredigion, a third of the population are over 65, and the prediction is it will get even higher. And loneliness as well is a huge problem.
And there's somebody to talk to.
Yeah.
And, and then Alice and the other micro carers, she takes me to hospital appointments and that sort of thing when she can. And we go to PC Gallery in Penrhydog,
Yeah.
art and keep fit.
Yeah.
It's actually a mental health issue, loneliness, and in fact it can be dealt with quite successfully via the micros. For example, in Ceredigion, a third of direct payments are for loneliness and social isolation. So, I think you can go to your GP.
Yeah, and we work with the social prescribers who are based through the GP surgery, so we're linked in with those. They know to refer to the directory, so if someone does come to see them who needs support, they can refer onto the directory if that's something they want to look at.
It could be that someone who's having sort of mental health problems is because they are lonely, they're not out in their community, they're not, we all know from COVID that that created huge mental health problems because people were isolated, they never saw anybody. So that's direct payments can actually, if you get some payment for helping with your social isolation, that could actually prevent it developing into full-blown issues that would require a lot more intervention.
It makes a day because they're always doing something. Some things that I can't do myself.
Yeah.
Which I was surprised that I got a shower because I couldn't get in the bath.
Yeah.
Things like that.
And what did we do? We did some drawing that time.
Oh,
didn't
yes, we do
couldn't go out.
We'd go out and we'd do drawing here. And
I forgot how good I was.
and then cooking.
Yeah.
But no, I couldn't manage.
So as part of our role, we do a lot of engagement. So we go to the third sector. We've been to a lot of different community groups and different organisations to spread the word about the directory, linking with social workers, with the health board professionals, just to make sure that if they see someone who's vulnerable or lonely or isolated or someone who needs support, that they've got the option of the directory if that's the choice for care that they'd like to look at, or care and support.
One of the main things what we're trying to do is just give people more choice. So, families can go to the directory and see what micro-enterprises are available. And then, as Lucy said, a lot of the work we do is explaining the option of micro-enterprises to all those signposting professionals in health, local authority, and the third sector. So thinking about social workers, direct payments, Age Cymru Dyfed, community connectors, social prescribers, then all your community nurses, district nurses, admiral nurses. So it can all be, signposted to people, who are particularly looking for that early prevention help. And I think prevention is another main driver of what we're doing. And I think that's the big gap that micro-enterprises are filling in the local care sector, with the main provider type being larger organisations. They're fantastic, but there's a huge demand for people needing daily care and quite high level care, which is what they're kind of really designed to deal with. So if you're someone who just needs a bit of help, perhaps you're becoming a little bit socially isolated, perhaps you just need 2-hour calls a week to help with a bit of cleaning, friendly face to help get out, to join local clubs, maybe even a bit of light touch personal care. With a larger organisation, it's quite often different staff coming each time. So particularly if it's that companionship you're after, and particularly for people who live with dementia, that continuity is really important. So what micro enterprises offer, most of them being self-employed, is that more personal relationship and that consistency to really build that relationship, to know what makes each other smile, their life story, and I think you can only get that true trusting relationship through that consistency and that one-to-one support.
Well, I've been a nurse for nearly 20 years now, and I was a specialist dementia nurse in the community. And I just felt that there was a huge need, an unmet need, and I welcomed the freedom of having my own business, being able to kind of to fit whoever I was working with, to enable them to do what they wanted to do.
And that's the joy, isn't it? Being a micro, you can be flexible. So like if you're a mum with kids, you can adjust your hours, you're your own boss. And I think, I've only been doing it 6 months, but that's the big thing. It's the flexibility, and it's also being able to, adjust your time so that you can make a difference, that you're there providing care, and it's not a 15-minute, oh, here we are, I got to go. It's a more wraparound care.
I still work at the hospital every week, and I love being a nurse, but it gives me great perspective for working in the community, because yes, we have time.
We talk about choice for people looking for care and support options. It's also choice for people in the care industry. Being a micro enterprise isn't for everyone, but for those people with the right skills and experience and organisational nous to be their own boss and to lead their own service, it's a nice career progression, and it's really helped keep people with a lot of experience and talent and passion for delivering care in the care sector in Pembrokeshire. So really helped with that retention of really great carers.
Having the guidance of Lee is hugely helpful, because I think I'm probably I'm not very good at the official bits, but the official bits are important. So he's this kind of handhold, I think, who guides you through the process. So I think just for your own kind of safety and insurance.
We've also recruited people into the care sector. So a lot of people that we've all spoken to have maybe left their caring role because it didn't work for them when they started a family, or for whatever reason. And then this opportunity of being their own boss has been their segue back into care. There's also people who haven't had a formal care experience but developed through being a family carer over a period of years or even decades, or done a little bit of volunteering, have really felt a huge purpose in that. And being a micro enterprise has kind of helped them to sort of formalise that. And usually those sort of people, they haven't got that experience in personal care, but there's still a big demand in the region for companionship and home help and that more preventative support, which really helps people to stay living independently in their own homes and communities and happily enjoying life for as long as possible.
I worked in various different care sectors. I took some time out to care for my husband and my mum, who both have got ill health. And I was looking for something, I wanted to care for people, but in a lot of my jobs I was restricted. You can't do that, you can't do this. And I wanted to care for people in a way that was tailored to their needs. And I'd heard about Lorna's company, got to know her husband and got to know about the business. And I was interested, and I approached Lorna because I knew that her company had a good reputation, and I wanted to work for somebody who had a good reputation, because I know that the care was tailored for the clients and their families.
Wellbeing support. Some people just need support, maybe to go to the shops. Maybe they don't drive and they don't want to go on a bus on their own, so they can ask someone to come and pick them up, take them out shopping with them, go for a cup of coffee, support them to go to a group. Maybe they've lost their confidence. Might be someone just wants someone to check in on their mum because they live far away and they want to know she's okay, and have a cup of tea and make her some food, or have a chat with her. It's that wellbeing, companionship, support, or just can you someone wants the hoover around, or can you wash the dishes and make them some lunch? It's whatever the client needs and wants.
You know, it's somebody coming in, and my daughter works in St David's with mentally handicapped. She's been there for years. Well, and my son works in the college, so they can't be here in the day.
No.
I mean, they're here at night. They see that I'm in bed tidy, you know.
Yeah.
But they're working, so they couldn't
Yeah.
be here in the day for me. I don't expect them. They don't have to worry.
The cool things about being part of the Micro Enterprise Network, you know, we're all through WhatsApp groups and, you know, communication from us three, help to plug micros into all the cool stuff that's available. So particularly in Pembrokeshire, the community connectors are great at signposting all the great stuff. So there's stories. I know a Micro Enterprise in Pembroke called Collins Care has taken one of his clients to an inclusive like martial arts class. There's, you know, dementia-friendly golf, dementia-friendly screening in the Torch Theatre. So I think it helps to kind of being part of the network to know all of the interesting things that are going on, lots of them free, that you can suggest to your clients to help them, you know, to try new things and again, just enjoy life and feel happy.
And with her help, we've got a new normal. And we like having the day-to-day routine. Jeanette helps me with my prosthetics, the tasks I can't easily do, like my hair, the personal care, and that really makes an enormous difference to my life and to that of my husband, who's then able to go out to work, my children. Jeanette's part of the family. She arrives in the morning, there's 2 crazy children going out of the door, and then peace and calm is restored and we crack on with our daily routine.
And it just stops, you know, other problems coming because, you know, if you're feeling well, if you're happy, you're less likely to become ill. You know, it's just well-being. I know it's a sort of modern buzzword now, but it is really important, and it just helps you with your resilience as well.
It was when COVID hit and I was still working for a care company prior to, and then I put little cards in the village shop in Crendale at the time, and I had lots of people wanting to have that support because it wasn't there when COVID hit, and I got so busy that I decided to quit my job, and I heard about the Micro Enterprise from one of my other friends who'd already joined, so I decided to go self-employed, and it's the best thing I did.
I think that COVID really brought the importance of social emotional well-being and, you know, the kind of danger of social isolation to light. And the project in Pembrokeshire started just before the pandemic, and as it was unlocking, we were starting to grow our directory. We started with 8 micro enterprises, but with, you know, the obvious links to the local authority and social services, what we found is that people in Pembrokeshire throughout the pandemic didn't feel as if they could come forward with these kind of what they felt as lower level issues and feeling lonely. And then when the world really did unlock and they felt they could go to social services and ask for help, we found that, you know, they were very quickly needing quite high level care because their needs had escalated during that time. So again, it's about prevention, the kind of gap that micro enterprises are trying to fill to really help people, you know, enjoy life and get that early help, you know, when they need it, so they can stay living in their own homes and communities.
And, you know, mobility is a big part of that as well. I think when you're isolated and you're not going out, you know, so even if it was just someone maybe who wanted to go for a walk, a well-being walk, but wanted someone to go with them because they didn't want to be on their own in case they fell, or just having that confidence. So again, it's all linked in with prevention.
I'm sure that the numbers of micros would grow, and it is a bit like mushrooms, you know, as you get more, it sort of creates more because people start talking about it, and it is such a no-brainer way of providing sort of care at that early stage. And yeah, I mean, I suppose it's got potential to transform the care landscape, the traditional care landscape, which we know it already has in Somerset, which is where it started, what, a decade ago?
Yeah, and I think it's it's proven through the results of the number of micros. There's well over 120 micro enterprises in the region. We know from some of our data that around 58 of them are providing over 2,000 hours of care and support every week. So you can see people are coming forward wanting to be micros. People in the community are going to the directory wanting support from micro enterprises. So it's growing, through word of mouth and organically. And I guess zooming out into a national picture, Pembrokeshire was the first microcare project in Wales, shortly followed by Powys and Wrexham and Ceredigion and Carmarthenshire. And there's now, I think, around 12 local authorities in Wales with a microcare project. We've now all come together and formed a community of practice. So we meet and share best practice and tips and what's happening, and also ask for help and challenges. And in the last 18 months, Welsh Government, through our success, has been taking more notice, so that they've recently published a microcare report and have come, and engaged with our community of practice and interested in, working with us. And I guess from their perspective, making sure that those kind of best practice principles are filtered across Wales, because each local authority has kind of done it in their own slight different way. So there are little nuances, but even without them, we're all coming together to help each other and share good practice.
Yeah, we've got people who are, like I said, taking on more people because they want to grow into a company. We've got people then who, have got ambitions perhaps to be on the brokerage system and be CIW registered, and that's absolutely fine, to come through, and we're actually, again, filling gaps and helping people progress and develop, which is really good that the project's able to deliver that. And we're not taking from domiciliary care. These are people who've perhaps left the care sector and they're coming back into it and they're staying in it, because they, like Sue said, they've got that flexibility. You can work locally, you can work who you want, when you want, and deliver the service that you want, but feel like you make a difference. So that's really interesting, that recruitment and retention and the growth is happening.
I think as well, what's really good about the project, which I found, sort of being relatively new, is people are really grateful to have support from a coordinator, because because when you're out on your own, as someone self-employed, you're usually on your own. But with this project, we're like the goalkeeper at the back. So I think that really gives them confidence in moving forward.
And being part of a network, because it can be quite a daunting and presumably lonely task to set up as a sole trader. But we've got really lively networks. Some of the micro enterprises in Pembrokeshire kind of meet up for Christmas drinks. There's a Costa Club in Milford, and support each other like any group of colleagues would. Sometimes someone might put a message on to say, a client passed away today, I'm feeling sad. So it's it's not just practical stuff that they help with, it's that emotional stuff that we all need from being part of a tribe and part of a community.
I've got two busy, nearly teenage children, but they don't bat an eyelid about Jeanette being in the house first thing in the morning or after school. If you're not here, they wonder where she is, in a nice way. So it works very well in the setup. They're much better than having individual carers from a care company, something where you don't see the same face. It wouldn't work. It couldn't work with my disabilities, having a different person. Because people. You've got to know what you need, isn't it? Without you having to, or I know where things are. Do you know what I mean? Like, and I don't have to ask you to do everything. She just does. Well, they just know. You just get to know after a while, don't you?
It's not. It's your life. It's become my life. It's not a job. It's a passion, isn't it? And you've got to. My motto has always been: you've got to care to care. You can have all the qualifications and everything, but if you don't care, then it's got to be a passion. You've got to have it in you that want to do it.
My advice would be, when you meet a client, to spend a few weeks just getting to know each other before you commit, and to make sure that you both get on and that you have a good rapport, because that's really essential. And if you do, you'll find it one of the most valuable and rewarding things that you can do.